been a registered respiratory therapist for 46 years, and I've kind of split evenly between adult critical care and neo-peds. I've done air med. So when you work for a large corporation, you get a lot of opportunities. But my passion really has been, since I received my master's, is really for public health, population health, and really reaching out to our most indigent poor. And many people with COPD, chronic obstructive pulmonary disease, are some of our most poor. Really poor habits, health habits, etc. So for me, my heart kind of swings toward that group of people. So what I've done is about 20 years ago, I really started on the journey to decrease or increase the access these patients had to healthcare, but in the right location. So not the hospital, but in their homes. So was probably a little ahead of the time. We didn't have a lot of remote patient monitoring devices, et cetera, but the product Adherium has was one of my dreams. Something that would tell me that I could remotely look at and say that a patient had taken their medications on a certain date and at a certain time and appropriately. And then with the addition of being able to measure the inspiratory flow, that had me at hello. So it became a very, very important part of what we're calling the Intermountain COPD and adult asthma remote evaluation study. And I think we're up to about $5 million now in funding between my organization, Adherium, and CareCentra. I thought about one lady, and she had been, previous to her enrolling in this study, she had been admitted to the hospital 5 times the year before. Just poor management, confusion about which med was their reliever and her controller, and how is she supposed to take them. And sometimes what we're finding is it doesn't matter how many times you've explained it to them, they still walk away thinking they understand it, and then they get confused. And there was no at that time resource for us to know, was she taking it correctly? And there's 2 parts of their story with her. We noticed on the platform that she was taking her reliever as her controller and the controller as her reliever. And we caught that by looking at the date and time she was taking those medications. Got back with her really quickly, set her straight again, and had her mark them specially so she would know the difference. But I think the most telling thing is she was one of our first patients enrolled in the study. Just a real brittle asthmatic. And she's been in the study now 13 months, and has not had one admission to the hospital. And for me, that's a huge success story of how your product helped us really guide the care of this patient at a time when it was most needed, not waiting for her to have to come into the clinic or be admitted to the ED or the hospital. But there in her home, we were able to tell her, here's what we need to do a little bit differently. And it's been highly successful for that reason. That and some other nudges that are embedded in the platform that we're using. Of course, when you're a pioneer, and we were pioneering my whole study team was just trying this new idea that we would use these 3 and really 4 monitoring devices and how they would intersect. And I'll take a step back and say that I'd been on our enterprise review committee for a care management program. And there were 20 of them that we looked at and investigated in detail. And I would ask every single company, do you have anything for pulmonary patients, lung patients? Nothing. Everybody had, diabetes, blood pressure, heart failure. They all had those, but nobody had this. And so early on, I realized if we could have these nudges and the alerts going to our pulmonary disease navigators, we'd probably have success. So when we first started, having devices sync and integrating them into a third party, vendor's platform that we had used with our company for heart failure, diabetes, early preterm labor, and had phenomenal success. So I guess you could say I got the best platform that I could with the best devices that we could find on the market at that time that were FDA approved. the most important thing is the fact that the patients don't have, a certain software program for one device and then have to go to another one for another device. It's all integrated, and then has oversight minute to minute, seriously, by our pulmonary disease navigators. And when you say, yeah, you've got 1 million pulmonary disease navigators, I don't. I have 7. And they're at our 5 Utah big medical centers. And the fact that they've moved with all this integrated software and the interplay between the devices and the nudging and the alerts, that now even the patients are starting to watch their different measures and self-managing much better, and knowing when to step up and add an antibiotic or a steroid has been a game changer. And I think that kind of integration, now that some of the kinks are worked out with devices staying synced and really issues with phones. Sometimes these smartphones are not as smart as we like to think they are, but we've had phenomenal success with putting the whole picture together, and the patient stories are amazing.